What is a fracture? A fracture is a broken bone. It can range from a thin crack to a complete break. Bone can fracture crosswise, lengthwise, in several places, or into many pieces. Most fractures happen when a bone is impacted by more force or pressure than it can support. If you suspect you have a fracture, seek medical help immediately. What are the symptoms of a fracture? Most fractures are accompanied by intense pain when the initial injury occurs. It may become worse when you move or touch the injured area. 12. In some cases, you may even pass out from the pain. You may also feel dizzy or chilled from shock. Other potential symptoms of a fracture include 1. A snap or grinding sound when the injury occurs. 2. Swelling, redness, and bruising in the injured area. 3. Difficulty supporting weight with the injured area. 4. Visible deformity in the injured area. In some cases, you may see broken bone poking through your skin. What are the different types of fracture? Fractures can be classified as closed or open, as well as incomplete or complete too. Closed versus open. A closed fracture is also called a simple fracture. In a closed fracture, the broken bone doesn't break your skin. An open fracture is also called a compound fracture. In an open fracture, the ends of the broken bone tear your skin. When your bone and other internal tissues are exposed, it puts you at higher risk of infection. Incomplete versus complete. In an incomplete fracture, your bone doesn't break completely. In other words, it cracks without breaking all the way through. Types of incomplete fracture include 1. Hairline fracture, in which your bone is broken in a thin crack. 2. Green stick fracture, in which your bone is broken on one side, while the other side is bent. 3. Buckle or torus fracture, in which your bone is broken on one side and a bump or raised buckle develops on the other side. In a complete fracture, your bone breaks completely. It's snapped or crushed into 2 or more pieces. Types of complete fracture include 1. Single fracture, in which your bone is broken in one place into 2 pieces. 2. Comminuted fracture, in which your bone is broken or crushed into 3 or more pieces. 3. Compression fracture, in which your bone collapses under pressure. 4. Non-displaced fracture, in which your bone breaks into pieces that stay in their normal alignment. 5. Displaced fracture, in which your bone breaks into pieces that move out of their normal alignment. 6. Segmental fracture, in which your bone is broken in 2 places in a way that leaves at least one segment floating and unattached. Incomplete fractures are more common in children. Their bones are softer than those of adults. As a result, they're more likely to bend than break. 3. Complete fractures can happen at any age. What causes a fracture? You can develop a fracture when your bone is impacted with greater pressure or force than it can support. This force usually occurs suddenly or is very intense. The strength of the force determines the severity of the fracture. Some common causes of fractures are 1. Falls. 2. Accidents. 3. Sports injuries. 4. Violence. 5. Overuse. 6. Osteoporosis. Osteoporosis is a condition that causes your bones to become weak and brittle. It makes them more likely to break even from minor stress or normal activities. 4. How are fractures diagnosed? To diagnose a fracture, your doctor will ask you about your symptoms and how you got injured. They will also examine your injured area for signs of swelling, deformity, tenderness, and movement. Your doctor may also order some tests to confirm the diagnosis and determine the extent of the damage. These tests may include 1. X-rays. 2. Computed tomography, CT, scan. 3. Magnetic resonance imaging, MRI, scan. 4. Bone scan. 5. Ultrasound. These tests can show the location, type, and severity of the fracture. They can also help your doctor plan the best treatment for you. How are fractures treated? The treatment for a fracture depends on the type, location, and severity of the injury. The main goals of treatment are 2. 1. Reduce the pain and swelling. 2. Align the broken bone pieces. 3. Keep them in place until they heal. 4. Prevent complications and infections. 5. Restore the normal function and appearance of the injured area. Some common treatments for fractures are 1. Immobilization, using a cast, splint, sling, or brace to keep the broken bone from moving and allow it to heal. 2. Reduction, manually or surgically moving the broken bone pieces back into their normal alignment. 3. Fixation, using metal pins, screws, plates, rods, or wires to hold the broken bone pieces together inside or outside the body. 4. Medication. Taking pain relievers, anti-inflammatory drugs, antibiotics, or bone-strengthening drugs to ease the symptoms and prevent complications. 5. Physical therapy. Doing exercises and stretches to improve the strength, flexibility, and range of motion of the injured area. Most fractures heal in a few weeks to months. However, some fractures may take longer to heal or may not heal at all. This can lead to complications such as 1. Delayed union, when a fracture takes longer than usual to heal. 2. Non-union, when a fracture fails to heal completely. 3. Malunion, when a fracture heals in a wrong or deformed position. 4. Infection, when bacteria enter the wound or the bone and cause inflammation and pus. 5. Compartment syndrome, when increased pressure inside a closed space, such as a cast, reduces blood flow and damages nerves and muscles. 6. Nerve or blood vessel damage, when the broken bone or its fragments injure nearby nerves or blood vessels and cause pain, numbness, tingling, bleeding, or loss of function. 7. Arthritis, when the cartilage that covers the ends of bones wears away and causes pain, stiffness, and inflammation in the joints. To prevent these complications, it's important to follow your doctor's instructions and take good care of your injury. You should also avoid putting too much stress or weight on the injured area until it heals completely. How can fractures be prevented? You can't always prevent fractures from happening, but you can reduce your risk by taking some precautions. These include 1. Wearing protective gear when playing sports or doing risky activities. 2. Following safety rules and regulations at work or on the road. 3. Avoiding falls by keeping your home well lit and free of clutter. 4. Using assistive devices such as canes, walkers, or handrails if you have balance problems. 5. Eating a balanced diet rich in calcium and vitamin D to keep your bones strong. 6. Exercising regularly to improve your muscle strength and coordination. 7. Quitting smoking and limiting alcohol intake to avoid weakening your bones. 8. Getting regular checkups and screenings for osteoporosis if you're at risk. Fractures are common injuries that can affect anyone at any age. They can cause pain, swelling, deformity, and loss of function in the injured area. They can also lead to serious complications if not treated properly.